Hi everyone, I wanted to briefly discuss a very common condition that is headaches. Most of us have experienced headaches and it is the most common cause of a neurology visit. So there are two main categories of headaches. The tension headache, which is the muscle aches, feels like a pressure around the scalp on a chronic basis. And then there's the category of migraine headaches. Some features of migraine headaches that distinguish it from other types is that it's usually a gradual onset of a severe throbbing headache on one side of the head, usually behind the eyes, around the sinus region, back of the scalp. And over the next several hours, it peaks and it can be very debilitating. It can be associated with nausea, sensitivity to lights and sounds. And a lot of patients experience focal neurological deficits, meaning they actually have visual loss, visual obscurations. They can't see very well, they can't speak very well. Even there are types of migraines that cause paralysis. And migraines are not just a headache. They involve actual electrical and chemical changes occurring in the brain. The usual pattern is inflammation of this trigeminal nucleus deep in the brain that leads to inflammation of its three main branches. These nerves innervate the orbital region, the sinus region, and the jaw, and it can lead to severe pain in those regions. And oftentimes they involve electrical changes in the brain, meaning there's actual electrical abnormalities that occur in the back of the brain, which often leads to the visual abnormalities. It can also involve electrical disturbances in the brainstem and deeper structures of the brain that lead to paralysis, difficulty with balance, and it can last several hours to several days. It can look just like a stroke in some patients. So there are some fantastic new treatments available for migraines that involve the blockage of those inflammatory chemicals with monoclonal antibodies, but there are also non-medication routes that can be very helpful. One of the more commonly used prevention strategies is Botox. So everyone's heard of Botox injections for cosmetics, but in fact Botox can be extremely helpful for treatment of migraines. And so the Botox is injected in several areas of the scalp, including the frontalis muscle, temporalis muscle, corrugators here, procerus, and in fact, these Botox chemicals lead to prevention of the release of the inflammatory, painful chemicals, and the benefits can last 3 months. It can be extremely helpful for patients who suffer from migraines and are just sick of taking medications that lead to side effects. There's also stimulation strategies whereby we can actually stimulate the back of the brain with certain parameters that send little electrical shocks that change the abnormal circuits that lead to headaches. So it's a fantastic day for patients who suffer from migraines because there are so many treatment options. And remember, taking Tylenol, Excedrin, over-the-counter painkillers is usually not the solution. In fact, it can lead to even more headaches called rebound headaches. Feel free to call us or go on our website, neurospabrain.com, to learn more, and I wish you the best. Thank you.